Today we are going to talk about the family planning methods that I had explained in my previous video. There are different types of family planning methods. They are hormonal. The hormonal types includes the pill and the injectable. The hormonal part prevents ovulation. The second one is the barrier method. This includes all types of condoms. There are vaginal cups, the diaphragm. All these are inserted in the vagina and it prevents the sperm from reaching the ovum. The other type is the spermicide. The spermicide literally kills the sperm. And this includes, there's a transparent film, tablets, forming tablets. All these are inserted in the vagina and waits for the sperm to kill it before it travels to reach the ovum. The other one is the intrauterine devices. These ones are inserted in the uterus and they work from 1 year to 10 years. But it can be removed if you are planning to get pregnant in between. While using the IUCD, someone has to be faithful to the partner or husband because it is like a media which helps sexually transmitted infections to travel into the internal organs, which can even bring not the IUCD, but I mean the infection can make one have something called like pelvic inflammatory disease, which is a very serious one. And at times some people are hospitalized because of the PID, pelvic inflammatory disease, which is caused by recurrent infections while using IUCD. So you have to be very much faithful to one partner. I hope I'm clear on that point. I'm talking about faithfulness. Secondly, your hygiene level must be very high. You have to be clean all through, especially your vagina or the whole body. At least bathe twice per day and concentrate on the vaginal region. Don't rush bathing quickly and then leaving some dirty areas around the vaginal area, because that infection will travel from the vagina to the uterus. I hope I'm clear. The second one is called vasectomy. Vasectomy is a surgical operation done on men. This one, somebody goes to theater and the vas deferens is cut, thus preventing the sperm from traveling to the ovum and the ovum to the uterus. It is done in a hospital, not at home. The other one is the tubal ligation. tube ligation is where the fallopian, I know you've done some biology, you know how the fallopian tubes are like this. Let me see, like this. So it is chopped, it's cut, it's a surgical, it's cut or tied and then or burnt. This one will also prevent the sperm and the ovum from meeting. The other method is the emergency pill. Which for this one I don't advocate for it so much because it has to be taken effectively so that it works efficiently. It's supposed to be taken 2 hours before sexual intercourse, and then within 48 hours after the sexual intercourse. Failure to that, you get a pregnancy. We advise people who opt for emergency pills to take a permanent method, not a permanent as a long-term method, but any method instead of getting used to the emergency pills. These pills are not so effective and later on may make somebody have an ectopic pregnancy, which is not good. When one gets an ectopic pregnancy, it means going to theater and getting one of part of your fallopian tube cut, because a pregnancy never grow or develop on the tubes. The tubes are so thin, and if not taken care of, it ruptures and it is an emergency. We don't want anybody to reach to that point. All these contraceptive methods I've talked about are either taken orally, that is the pills, the injection is injected, as the word indicates, barrier is inserted in the vagina, IUCD is inserted in the uterus. Yes, kindly visit any health facility near you and get assistance so that you can make an informed choice on which FP method you are going to adapt. They are offered in all hospitals. As I told you earlier, there are different types of hospitals, the classes, the levels. Level 1 is a dispensary, 2 health center, like that, 3, 4, 5, 6, and 6 is a referral hospital. All those methods and services are provided there. Kindly avail yourself and visit any. Thank you so much. Next time we are going to talk about a different topic, or maybe emphasize on the same topic for those who may not have got everything that I've talked about. Thank you.